I'm really delighted to be here with Minister Donohoe to announce what is a really important step on our journey to universal healthcare. 500,000 more men, women and children will now have access to free GP care around the country. It includes nearly 80,000 6 and 7-year-olds and about 430,000 people up to the median income. It's the largest expansion of access to free GP care in the history of the state, and it means that for the first time ever, more than half the population of Ireland will now have free access to GPs. For universal healthcare to be a reality, healthcare has to be affordable. And we know that the charge of 55 or 60 or 65 euro, it simply isn't affordable for many people around Ireland today. And it means that adults and children therefore aren't seeing their GP when they need to see them. And this measure is targeted at those people who really can't afford the current charges. It's the latest measure aimed at making healthcare affordable for people. It comes on top of the free contraception scheme, the abolition of inpatient hospital charges, government funding for diagnostics via GPs, and reductions in the monthly maximum that people pay for medicines. And later this year we will be introducing state funding for IVF, and we'll be expanding the free contraception scheme as well. When this measure was announced, GPs right across the country quite rightly pointed to the need for more investment in general practice and for more GPs if this was going to work. And this expansion in access comes with considerable new investment, which has been negotiated with the IMO over several months. It includes payments for all of the new people covered. It includes increases in payments for those who are already covered with a medical card or a GP card. It includes important increases in supports for staff for GPs so they can expand their practices. And I'd really like to thank Minister Donohoe for all of his support in getting us to where we are today. I want to acknowledge a very constructive role that's been played by the IMO, and it was really positive to see the IMO's GP committee has endorsed the agreement. We're also taking some big steps in terms of increasing the number of GPs. Right now we've got about 3,500 GPs in the country. It's about 6.9 GPs for every 10,000 people. It's similar to the UK levels, but it's low when you look around the OECD at what other countries are doing. So we've been working on this. We've been substantially increasing the number of GPs in training. Just in the next year, the number is going to increase by about a third. It's increased by threefold since 2009. And the ICGP has been doing really important work in its non-EU GP programme, going from 50 GPs to 250 GPs. And we'll move from about 930 GPs in training to around 1,300. The result of all of this is we should see an increase in the coming years of about 1,000 GPs. That'll move us from a ratio of 6.9 per 10,000 to about 9 per 10,000. That is a much healthier position for us to be in. It puts us in the same place as countries like Spain, France, the Netherlands, and really lays the groundwork for what we're in the middle of, which is a fundamental restructuring of our health service, moving away from a hospital-centric system to a community-based healthcare system with GPs and practice nurses and all the staff who work in general practice absolutely core to that. Thank you.
So I want to join with Minister Donnelly in welcoming this very important decision that has been made by government today, and the agreement at the conclusion of a demanding process with the IMO. In particular, I want to recognise the exceptional work that Minister Donnelly has done to get to this point. This was a priority that was identified by the government in last year's budget, and due to the hard work of Minister Donnelly and his team, we've now reached a very, very significant point in turning that announcement into a reality. The detail and many important aspects of this decision have already been covered off by the Minister, so I just want to emphasise a few points in relation to it. The significance of where we are can't be underestimated because it involves the largest expansion in eligibility for free GP care in the history of the state, covering off, as the Minister has said, up to 500,000 people. And critically, this will be happening at exactly the time in which the cost of living continues to be a challenge for so many, while we're seeing some positive signs take place with the rate of inflation. The reality is still of an economy and of a society in where prices going up, and many continue to find that difficult to deal with. So this intervention is coming at a particularly timely point as well from an economic perspective. I also want to recognise some of the very important reform elements of the agreement that has been reached here, such as the payment of a grant to co-ops to assist with the provision of reformed care services, such as, for example, telephone consultations in respect of patients in nursing homes, those receiving palliative care, or efforts that are made to avoid hospital attendance more generally. Overall, what myself and the Minister will now work on is the steps that are needed to build up our health services in a community setting, and we recognise that in addition to the delivery of primary care centres, how we can continue to collaborate with our GPs is essential in the provision of primary care services and the strengthening of our health services overall. And crucially, this agreement ensures that the government continues to work constructively and positively with key stakeholders so that this expansion is delivered carefully and in a phased manner. So from an affordability perspective and a healthcare perspective, this is an important development, a really important policy intervention, and I want to thank Stephen for his huge work to make this happen.